Welcome to Portland Public Schools Standard Operating Procedures Training. This training will go over the symptom space requirements. The intent of this procedure is to mitigate the risk of transmission from an ill individual to other school occupants and provide requirements and recommendations when establishing a designated symptom space in school buildings. Each school must provide a space that is appropriately supervised, adequately equipped, and isolates a symptomatic individual from building occupants. When students are identified with symptoms requiring exclusion, they should be placed in the symptom space until released to go home. It is the responsibility of the building administrator or designee to ensure that all procedures and protocols contained herein are followed and the appropriate actions are taken. In addition, ensure a safe and quick response is taken to help safeguard staff and students and mitigate any possible outbreak inside the building. The symptom space should observe public health guidelines to the extent feasible to ensure each element of infection prevention is followed as per COVID-19 guidance. The symptom space should be logistically accessible in proximity to the health room. MESD has adopted CDC symptom space guidelines for incorporation in the Communicable Disease Management Plan. These guidelines are based on the following 5 principles. The symptom space must be separate from routine health room. The symptom space must have appropriate ventilation. Students must be supervised while in symptom space. Staff must have appropriate PPE while in the symptom space. And appropriate physical distancing, barriers, and confidentiality must be maintained in the isolation space. MESD and CDC guidelines and recommendations for the symptom space. For physical distance, maintain a distance of 6 feet or more between cots, chairs, or isolated individuals. Establish a non-permeable barrier between isolation spaces, which can be sanitized or removed between isolated individuals, such as plastic sheeting. A barrier should be 6 feet or more in all directions from isolated individuals. To limit the risk of exposure to aerosolized particles, plan disinfection after space has been empty 4 hours, or disinfect while wearing full PPE. After dismissal of ill student, close off areas used by sick person and do not use those areas until after cleaning and disinfecting. Ensure safe and correct use and storage of cleaning and disinfection products, including storing products securely away from children. For ventilation, designated symptom spaces should have adequate ventilation. They should have exterior windows, functional unit ventilators, or building HVAC ventilation. Do not use fans if doors and windows are closed and fans are recirculating classroom air. For hand hygiene, care providers should wash hands frequently and thoroughly before and after providing care, including after removal of gloves. Ensure isolation space has ready access to soap and water. Sink at the entry is preferred. If soap and water is not accessible, use hand sanitizer with 60% or greater alcohol content and wash hands with soap and water as soon as possible. Staff tending to symptomatic individuals should wear, at a minimum, a medical-grade face mask. Additional PPE may be needed, such as gloves, face shield, etc. Any PPE used during care of symptomatic individuals should be properly removed and disposed of, or disinfected as appropriate prior to exiting the symptomatic space and hand wash after removing PPE. For student safety and well-being, consult school nurse for direct care provision, adjust protocols to age and developmental abilities, ensure line of sight, and keep ill student visible. And to reduce fear, anxiety, or shame related to isolation, provide clear explanation of procedures, including use of PPE and hand washing. For supplies and materials, clear plastic barriers, cots, chairs, PPE, and other health supplies needed to screen symptomatic individuals. The building administrator will designate and supervise school personnel who monitor individuals in the symptom space. Designated personnel must successfully complete annual training on identification of COVID-19 symptoms. And school personnel with direct involvement in utilization of symptom space will be retrained as necessary. Thank you.